Hello, this will be the Chapter 34 lecture. It will begin on page 580 in the textbook. Now, this lecture is a little bit lengthy. You may want to consider watching this video in portions, maybe 15 to 20 minutes worth at a time. Step away, come back later where you left off, and pick back up to get through it because there's just a lot of information in this particular chapter. So we're going to start here again, Chapter 34. It begins on page 580. First thing they have us looking at is a figure 34.1, which is on page 581 of the textbook. It depicts the nervous system and some of the various parts involved. And I apologize that this is not blown up. This particular PowerPoint slide does not do right whenever I blow it up to full screen. That is why we are looking at the smaller version. So let's get into the anatomy of the nervous system. So first we're going to look at the central nervous system, or CNS. This includes the brain and spinal cord and controls all nervous system functions directly or indirectly. We also have a peripheral nervous system, or PNS. The peripheral nervous system is divided into two other systems, the somatic nervous system and the autonomic nervous system. The autonomic nervous system is broken down into yet two more nervous systems, the sympathetic nervous system and the parasympathetic nervous system. So functions of the nervous system. These are the numbered points on the bottom left of page 580. So first we have sensory or afferent. This sends impulses from other parts of the body toward the central nervous system. Senses external changes or conditions in the environment, such as cold or heat, and senses internal changes in the body, such as decrease in potassium or calcium. Point number 2, we have integrative. This function processes perceived information about the sensory changes and interprets or explains them in the external and internal environments. And number 3, the motor or efferent. This sends impulses away from the central nervous system to other parts of the body. It allows and controls body movement and causes glands to secrete hormones or other chemicals into the bloodstream. So let's take a closer look at the neuron. This is the smallest unit of the nervous system. The brain is made up of about 1 billion neurons. They differ from other cells as they have dendrites and axons. These are projections with special functions. Dendrites bring information to the cell body from the central nervous system, and axons take information away from the cell body to the central nervous system. The neurons send information to other neurons to control glands, organs, or muscles. Electrochemical hormones, or neurotransmitters, are produced by neurons and stored in the ends of the nerve cells. Neurotransmitters such as acetylcholine cross synapses, spaces between neurons, then attach themselves to receptors. So there are 3 basic steps to neurotransmission and receptors. The neurons release neurotransmitters. Neurotransmitters bind to receptors or uptake, and binding passes on or continues or transduces the neurotransmitter's message. Figure 34.2 is demonstrating the neuron for you. You can see the dendrite as those little finger-like arms that are coming off of the neuron. We have the end buttons, the convergent axon, the cell body, converging axon again, the nucleus, and the axon itself. So the central nervous system, this is on page 583 now. We're going to look at the various parts, and we're going to start with the spinal cord. So the spinal cord consists of 31 paired nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. There are 5 main regions to the central nervous system. That is the skull, cervical vertebra, thoracic vertebra, lumbar vertebra, sacral vertebra or sacrum. And the spinal cord is protected from injury by cerebrospinal fluid, or CFS, that is contained in a system of fluid-filled cavities called ventricles. Next, let's look at the brain. So the skull protects the brain from injury. The brain divides in half lengthwise into two cerebral hemispheres. Each hemisphere is divided into 4 lobes. The frontal lobe, which processes higher intellect and reasoning. The parietal lobe, which is where perception of touch, pressure, temperature, and pain occurs. Temporal lobe, which takes care of our auditory senses. And the occipital lobe, which processes our vision. So within the brain, we have a cerebellum. This is behind the brainstem, below the cerebrum. It coordinates movement of the body, maintains equilibrium and balance. The cerebrum, on page 584, is the cerebral cortex, contains gray matter and controls voluntary actions. It also has the cerebral medulla, which contains white matter and conducts nerve impulses to and from areas of the nervous system. So the brain stem is where you will find the thalamus, hypothalamus, pons, and the medulla oblongata. Reticular formation is located throughout the brainstem and cerebrum. It is a network of nerve fibers known as the reticular formation, and it affects the degree of alertness. It is made up of 2 types of fibers. Excitatory fibers, when stimulated by external stimuli such as noises, bright lights, or danger, asserts the degree of alertness, or it increases the degree of alertness. And also the inhibitory fibers. An absence of external stimuli causes the inhibitory fibers to become more active, which in turn decreases the activity of the excitatory fibers and therefore the degree of alertness. And we have the limbic system, and I'm now on page 585. The limbic system is not well understood, but it is a specific neural pathway formed by nerve cells in various areas of the brain. It's also associated with emotional and behavioral responses, such as sexual behavior, anger, rage, fear, anxiety, reward, and punishment. So figure 34-3 on page 584 is depicted here, showing you these various parts of the brain. So let's look now at the blood-brain barrier, again on page 585. So the blood-brain barrier is a semi-permeable membrane that allows or prevents entrance of substances to the brain. So water-soluble or low-lipid-soluble molecules do not penetrate the blood-brain barrier, but highly fat-soluble molecules do. Large molecules do not easily pass the blood-brain barrier, and highly electrically charged molecules are slowed down by the blood-brain barrier. So the blood-brain barrier protects the brain from substances in the blood that could injure the brain. Hormones and neurotransmitters from the rest of the body. So it's protecting the brain from those hormones and neurotransmitters as well. And the blood-brain barrier also maintains a constant homeostatic environment for the brain. So the blood-brain barrier can be comprised of disease states such as hypertension, certain infectious agents, and hyperosmolarity, and physical changes as well, interrupted developmental stage, exposure to microwaves or radiation, and brain injury. Let's look now at the peripheral nervous system. And again, it's broken down into various parts. The first part of the peripheral nervous system that we'll look at is the autonomic system. This controls nerves that connect to smooth and cardiac muscles. It regulates involuntary movement to perform intricate functions without consciousness or voluntary direction. It is subdivided into 2 nervous systems called the sympathetic and the parasympathetic nervous systems. So we'll look a little closer at that sympathetic nervous system first. It is governed by the neurotransmitter norepinephrine. It prepares the body for energetic tasks and stressful situations. It also controls our fight or flight response, which stimulates the heart, lungs, and blood vessels and decreases the activity of gastrointestinal and genitourinary functions. So the parasympathetic nervous system also prepares the body for sleep in non-stressful periods. It affects the rest and relaxation response, decreases activity of the heart, lungs, and blood vessels, and increases activity of gastrointestinal and genitourinary functions. Now we'll look at the somatic system. This carries motor and sensory data to and from the central nervous system. It is responsible for voluntary muscle movements and for processing sensory information like hearing, touch, and sight. Their neurotransmitters are essential to proper brain function, how messages are sent and received, molecular substance that can alter mood, hunger, anxiety, sleep, rate of the heart, body temperature, fear, aggression, and other psychological conditions. Table 34.1 depicts the nervous system and its relationship with the body. I'm not going to go through that table. I highly recommend that you do so, though. So let's look at diseases affecting the central nervous system. This begins on page 586. The first of these diseases we're going to take a look at is anxiety. This is an uncomfortable emotional state characterized by apprehension, worry, and fear. It is associated with the following risk factors: genetics, brain chemistry, life events, and personality. Table 34.2 on page 586 depicts types of anxiety. Do please look through this table. It details out these different types of anxiety, and there will be some test questions regarding these. Again, though, I am not going to go through this table personally. I find that when it comes to the charts and tables, it works best just for you to look through those at your own leisure. So with anxiety, there is a lack of the neurotransmitter gamma aminobutyric acid, or GABA, and it is associated with anxiety. So treatment can include cognitive and behavioral therapy, psychotherapeutic drugs such as benzodiazepines, antidepressants, SSRIs, tricyclic antidepressants or TCAs, monoamine oxidase inhibitors or MAOIs, and beta blockers. Table 34.3 is detailing pharmaceutical treatments for anxiety, and that can be found on page 588 in the textbook. Once again, though, I'm not going to read through this table, but I highly recommend that you do so. So let's look at depression. This is another disease affecting the central nervous system. Symptoms include feelings of despair, lack of energy, inability to concentrate. It's related to decreases in concentration of the neurotransmitters. And it's treated with drugs that block the reuptake of neurotransmitters and interfere with the breakdown of the monoamines within the synaptic cleft. So there are types of depression. This would include seasonal major depression, seasonal affective disorder, postpartum depression, bipolar disorder, and dysthymia, which is a mild depression on most days of the year. So risk factors include genetics, trauma and stress, pessimistic personality, physical conditions, and other psychological disorders. Table 34.4 depicts pharmaceutical treatments for depression, and that table is found on page 590. Again, do please look through that table at your own pace. Now let's take a closer look at bipolar disorder. You will find this on page 589 of the text. Bipolar disorder is characterized by severe emotional highs, mania, and lows, which is the depression. Episodes or mood swings can last hours, days, months, or even years. This is caused by excess norepinephrine and possibly other neurotransmitters, and deficiency of monoamines, neurotransmitters such as serotonin, norepinephrine, or NE, or dopamine. Treatment for bipolar disorder may include lithium positive ions. These help the reuptake of NE and dopamine and reduce the release of NE and dopamine from the nervous neurons, thereby reducing hyperexcitability of the nerves. And antidepressant drugs may be utilized as well. Table 34.5 on page 591 depicts pharmaceutical treatments for bipolar disorder. Again, please do look through this table at your own pace. Next, we have psychosis. Psychosis is on page 591 of the text. This is a state in which a person is out of touch with reality. Schizophrenia is a type of psychosis characterized by illogical thoughts or paranoia, hallucinations, delusions of grandeur, poor hygiene, and disturbed sleep. Treatment can include atypical antipsychotics developed in the 1990s that have a lesser side effect and thus better compliance. Antipsychotics decrease dopamine levels. Antipsychotics may interact with other drugs, including antihypertensive agents, anti-epileptics, anticonvulsants, and anti-Parkinson drugs. Table 34.6 depicts the pharmaceutical treatments for psychosis. And that is on page 593 of the text. I'm sorry, it begins on page 592 and carries over to page 593. Again, please look at this table at your leisure. Insomnia. Insomnia is found on page 593 of the text. This is the inadequate or poor quality of sleep. It can include difficulty falling asleep or returning to sleep, waking up too often in the night or too early in the morning, and poor energy or not waking refreshed. This is usually treated with over-the-counter antihistamines, and there are also prescription sedatives available. So with those prescription sedatives that are available, we have the hypnotics, sedatives, and barbiturates. Hypnotics cause drowsiness and induces or maintains sleep, whereas a sedative or tranquilizer is going to calm and relax. And barbiturates are sedatives, but they can also be very addictive. All are depressants used when insomnia is caused by a disturbance other than depression. So table 34-7 on page 594 depicts the pharmaceutical treatments for insomnia. Again, please look through this table at your own pace. So we also use benzodiazepines for insomnia. They bind to all three BZ receptors and relax muscles at higher doses. Hypnotics and sedatives are going to use a lower dose, and antioxylytics bind to the GABA A receptors and potentiate or increase the actions of GABA. Ramizacon or flumazenil treats overdose. Table 34.8 depicts sedative and hypnotic drugs. This is found on page 596 of the text. Again, please look through this table at your own pace. And then also for insomnia treatments, we have non-benzodiazepines. These are the hypnosedatives or the Z drugs such as zolpidem, Zepbound, and Zopiclone. Now let's look over at the stimulants. This begins on page 597. This is a class of drugs that enhance brain activity and increase alertness, attention, and energy. They are used to treat narcolepsy, attention deficit hyperactivity disorder, or ADHD, attention deficit disorder, ADD, and depression that has not responded to other treatments. Adverse actions of stimulants can include feelings of paranoia, anger, or hostility. Most serious would be fatally high body temperatures, seizures, arrhythmias, and cardiovascular failure. Less serious adverse reactions would include headache, dizziness, diarrhea or constipation, restlessness, tremor, nervousness, anxiety, insomnia, dry mouth, unpleasant taste in the mouth, erectile dysfunction, changes in libido, GI disturbances, and weight loss. Contraindications for glaucoma, hypertension, coronary artery disease, or an overactive thyroid gland. Withdrawal treatment would include tapering off the drug, possibly antidepressants, and maybe even detoxification. Let's look at ADHD and ADD. It's page 597 on the right-hand side. So ADHD refers to attention deficit hyperactivity disorder. This is a condition in which a person has a very short attention span, is easily distracted, excessively active, and possibly overly emotional or highly impulsive. Versus attention deficit disorder, which is basically the same but without the hyperkinesia. So typically you're going to use or see use stimulants for the treatment of ADHD and ADD. These stimulants can include Ritalin, that goes by the generic name methylphenidate. Dexedrine goes by the generic name dextroamphetamine. Adderall, that goes by the generic name dextroamphetamine sulfate, dextroamphetamine saccharate, and amphetamine aspartate, amphetamine sulfate. We also have Concerta, generic named methylphenidate. And there is a non-stimulant treatment available under the name Strattera, generic name atomoxetine. So again, Strattera is the non-stimulant option available for treatment of ADHD and ADD. Side effects can include mood swings, ear infections, and influenza. Side effects in adults can also include decreased libido, difficulty in ejaculation, erectile dysfunction, urination problems, painful menstrual cycle. Table 34.9 depicts pharmaceutical treatments for ADD and ADHD, and you can find this table on page 598 in the textbook. Next, let's look at epilepsy. Convulsion, seizures, and epilepsy. We're going to start first with the epilepsy. This is a central nervous system disorder in which the patient may have convulsions or seizures. And I am now on page 599 in the textbook. So there are a variety of types of seizures. There are partial seizures that travel short distances on one side of the brain. Generalized seizures can travel anywhere throughout the brain on both sides. And partial seizures are further classified as simple partial seizures or partial complex seizures. Simple partial seizures affect only one side or portion of the brain and usually occur without loss of consciousness. Whereas the partial complex seizure may or may not lose consciousness. Convulsions are physical muscular manifestations of this disorder, and seizure is the irregular electrical activity in the brain which may cause the convulsions. So again, with those types of seizures, there's that partial seizures that travel the short distances on one side of the brain. Simple partial seizures affect only one side or portion of the brain, usually no loss of consciousness, versus those partial complex seizures that may or may not cause loss of consciousness. We also have the generalized seizure that travels anywhere throughout the brain on both sides. There are tonic-clonic seizures, commonly known as the grand mal seizure. These are the most severe types of seizure, and they involve the whole brain. Myoclonic seizures are characterized by convulsive twitching of specific body parts or muscle groups for a brief period. Absence or petit mal seizures affect the whole brain. The person appears to zone out. And status epilepticus. This is a medical emergency. Any seizures that are generalized, last longer than 5 minutes, or are repeated. So immediate administration of IV anticonvulsant, anti-epileptic medication is warranted before cerebral cortex damage or death occurs as a result of the catecholamine surge. On page 600, we have treatments of seizures and convulsions. So this would include anti-epileptic drugs that work in 3 modes of action. Drugs that slow down an influx of sodium positive ions that go outside the neuron. Drugs that slow down an influx of calcium positive ions that stay outside the neuron. And drugs that speed up the influx of chloride ions or chloride negative ions that go outside the neuron. Table 34-10 on page 600 depicts 3 major drug classes used to control seizures. Again, please go through that table at your own pace. Parkinson's disease. This occurs as neurons that produce dopamine begin to malfunction and progressively die. There is no cure, but certain drugs can help manage the decline in motor function and activity as disease progresses. Pharmaceutical treatments can include levodopa, carbidopa, and adjunctive therapy, Parladel and Eldepril. Table 34.11 on page 601 depicts those pharmaceutical treatments for Parkinson's disease. Again, please go through this table at your leisure. Now let's take a closer look at dementia. This is on page 603 in the textbook. Dementia is a progressive brain dysfunction with a loss of cognition that leads to gradually increasing restriction of daily activities. Alzheimer's is only one type of dementia. The signs and symptoms of dementia would include loss of short-term memory, trouble with abstract thinking, and confusion or disorientation. Treatments for dementia include treat any infections that may be underlying cause. Goal of pharmacotherapy for irreversible conditions is to control symptoms and delay worsening. Tranquilizers and sedatives. Cognex, or Tacrine is the generic name, is a reversible cholinesterase inhibitor used for Alzheimer's. Table 34.12 depicts drugs that are used for the treatment of Alzheimer's disease, and that can be found on page 604 in the text, along with migraine headaches, also on page 604 in the text. The migraine headaches are very painful headache, usually on one side of the head, that tends to recur. A classic migraine can include the experience of an aura 10 to 30 minutes prior, intense throbbing or pounding in the forehead, temple, ear, jaw, or the entire area around the eyes. And this can last for 1 to 2 days. A common migraine usually is not going to have an aura. There may be a mental fog, mood swings, fatigue, and unusual retention of fluid prior to the onset. There may also be abdominal pain, polyuria, and nausea, vomiting, and or diarrhea, and any of the combination thereof throughout the migraine. So causes and treatment of migraine. This may be a chemical or electrical problem in certain parts of the brain where blood flow is changed. Can be triggered by certain medications, foods, and even hormonal changes. Pharmaceutical and non-pharmaceutical treatments are available. So table 34.13, this is on page 605 of the text, depicts drugs used in the treatment of migraines. And yet again, please go through this table at your own pace. As you can see, it's a pretty good sized table. Cancer pain, this begins on page 605 of the text. So 30 to 50% of cancer patients experience pain while undergoing treatment. 70 to 90% of patients with advanced cancer experience pain. Acute pain comes on suddenly. Chronic pain lasts beyond the expected time. And breakthrough pain is acute pain flare-up not controlled by usual medications. So treatment of cancer pain can include mild pain can include non-opioid analgesics such as acetaminophen and NSAIDs like ibuprofen, Advil, Aleve. Severe pain would include those opioid analgesics such as the Duragesic, which is generic name fentanyl, and that is a transdermal system. It's a patch where the medication is forced through the skin. And adjunctive drugs enhance the pain relieving actions of opioid analgesics. Non-pharmaceutical pain relief could include transcutaneous electric nerve stimulation, or TENS. A lot of us at this point in our lives have heard reference to a TENS unit. Table 34.14 depicts selected narcotics used to treat pain. And that table is found on page 608 of the text. Again, please look through this table at your own leisure. So let's look at some of the other conditions that affect the central nervous system. We have Bell's palsy. This is face muscles freeze due to trauma to a cranial nerve 7. Stroke is disturbed blood. Disturbed blood flow or seeping out of blood from outer vessel walls. And Tourette syndrome is a neurological disorder of the brain. It comes usually with tics, and sometimes the person even has a tendency to blurt out random things. Tourette is found on page 609 of the text. So let's summarize this big chapter 34 full of information. The central nervous system is complex and interacts with every other system in the body to ensure homeostasis and to regulate the body's responses to internal and external stimuli. Many diseases and conditions affect all aspects of central nervous system. Neuropharmacology is one of the most diverse and complicated areas of pharmacology. That is the chapter 34 lecture. I hope that has helped and assisted you. And I hope that you have a great day.